Hello, and welcome to today's Essential Together Huddle, Family Presence, Mutual Expectations with Saskatchewan Health Authority. I'm Carol Fancott, Director of Patient Engagement and Partnerships at Healthcare Excellence Canada, and I'm pleased to be your host today. Please note that this session is being recorded, and we are pleased to be able to offer this webinar with simultaneous interpretation. If you would like to hear the voice of our interpreter today, please select French from the interpretation menu at the bottom of your screen. And we invite you to use either official language to share your questions, ideas, and comments in the chat throughout today's session. I would like to start by acknowledging that we are meeting on land that has been inhabited by Indigenous peoples since the beginning. In particular, we acknowledge that we are broadcasting this webinar from Ottawa, which is the traditional and unceded territory of the Algonquin Nation. We recognize and deeply appreciate their historic connection to this place and the opportunity to gather here today. If you have not yet done so, please do take a moment now to respond to the 3 poll questions on your screen. Please scroll down to see all the questions in both English and French, and be sure to click Submit to send your responses to us. As I introduce the guest speakers, I'd ask that you please take a moment to introduce yourselves in the chat box and where you're joining us from today. So it is my pleasure to introduce the team from Saskatchewan Health Authority. Kristin Grudert is the Director of Patient and Family-Centered Care. Kristin leads a team of patient and family-centered care specialists from across Saskatchewan. And during this time of pandemic, Kristin's team quickly turned their attention to family presence and created purposeful engagement and partnerships to create policy and processes. And when out of office, Kristin can be found trying to keep up with her 2 busy boys who love sports and helping her husband on their family farm. Amber Clark is a patient and family-centered care specialist for the Saskatchewan Health Authority. She enjoys using her background in adult education and her training in plain language to create resources that make patient and family-centered care accessible and actionable for everyone. And outside of work, Amber enjoys DIY projects, yoga, and spending time with her 3 kids. And lastly, Erin Kell is also a patient family-centered care specialist with SHA. Erin has been supporting the family presence throughout the majority of the pandemic. After hours, she enjoys running, kayaking, gardening, and spending time with her husband and 4 children. We also have our producers and offer great appreciation to them for getting us on the air today, Gina Peck and Sheena Powell, who are operating behind the scenes. And welcome to all of you, and especially a warm welcome to patients, residents, families, caregivers, and essential care partners who may be joining us today. Essential Together Huddles are intended to be a safe space for all of us to be able to share what we're learning about the work that you've been doing and what you've been experiencing. And it's an opportunity to connect with people who have different roles in the health and care sectors, who bring different perspectives and experiences and come from different care settings, but all with a shared focus on safely welcoming back caregivers as essential care partners. So a little bit about us. Healthcare Excellence Canada is a newly amalgamated organization that has brought together the Canadian Foundation for Healthcare Improvement and the Canadian Patient Safety Institute. And we have a relentless focus on improving healthcare with and for everyone in Canada. In today's session, I'm going to provide a very brief overview of the Essential Together program, and then you're going to be hearing from the folks from Saskatchewan Health Authority and how they have put policy into action by developing a set of mutual expectations for patients, caregivers, and staff in order to safely reintegrate essential care partners back into their facilities. And as always, the goal of these huddles is the opportunity for all of us to share what's happening across Canada and to learn with and from each other. So what is essential together? It is a program that's been developed in response to what's been happening during this time of COVID-19. And it has implications well beyond this time of pandemic to really support the safe reintegration of essential care partners into health and care settings during this time of pandemic and beyond. There are 3 specific audiences for this program: policymakers, those that implement policy, and those that are impacted by policy. And the focus of these national huddles really concentrates on the actions to implement policy guidance. Now, you will notice we use the language of essential care partner, but we do know that different language is used across the country, such as designated caregivers, designated care partners, essential visitors. So how can we safely reintegrate essential care partners? Last summer, we hosted a policy lab that brought together a range of stakeholders: policymakers, healthcare leaders and administrators, patients and caregivers, to understand what is the ideal journey for caregivers to safely be reintegrated into health facilities. And based on the journey map that was developed, we then co-developed policy guidance that focuses on 2 main areas that you'll see on this slide: that of identification and preparation of essential care partners and entry into facility. There are 7 components to the policy guidance, and today we're here to learn more about develop mutual expectations of responsibilities, of which who are your essential care partners, and that is supporting residents, patients, clients to identify and designate those who are deemed most important that participate in their care together. And the national huddles will focus on different elements of the policy guidance in the coming weeks. At the core of the policy guidance and for Essential Together are 3 foundational principles, and that is recognizing and acknowledging the essential role that families or other caregivers play as essential care partners. It's the ability to differentiate this role from that of visitor, and to engage with patients, residents, clients, as well as families, caregivers, and essential care partners to implement and to develop and implement new policies and practices. As a program, we want health and care organizations to commit to a call to action. There's an Essential Together tool that supports reflection of the 7 key elements of policy guidance. There are learning bundles for each of the elements of the guidance with curated resources and tools. And then there's peer learning, like these huddles that are in place. And we also offer additional coaching for teams to support implementation. Before I hand it over to Kristin, Amber, and Aaron, we will quickly just recap on the poll results. And I'm just going to pull them up on my trusty phone here. So the first question of who's joining us today. I am actually just looking here. I'm not sure if we have the poll results here. There are many joining us from across the country, from all of the settings. In terms of the process of where folks are at to ensure consistent coordination, it is in progress. And I believe the last question was the process, and again, it's in progress. So I'm going to hand it over now to Kristin, who's going to get us started. And as a reminder, please do use the chat box to share your thoughts, comments, and questions, which we will get to after the presentation. And so thanks very much, and over to you, Kristin.
Sure, thanks, Carol. Hi, everyone. Always a pleasure to partner with Healthcare Excellence Canada, and we're really happy to be here today from the Saskatchewan Health Authority. I'm going to be walking through our slides today in our presentation, but this is most definitely a team effort. I can't even begin to stress enough, and I think you'll see through our presentation that it's certainly not just the 3 of us that have gotten the Saskatchewan Health Authority where it is with family presence today. So with that, we can go to our first slide. Okay, so just a little bit of background about the Saskatchewan Health Authority. We're actually a very new organization. We came together in December of 2017. We used to be 12 smaller health regions. And we now operate as a single organization, and we work closely with the government of Saskatchewan, 3S Health, the Saskatchewan Cancer Agency, eHealth, and the Health Quality Council. And we are very pleased to be here today representing the patient-client experience portfolio in the SHA. So our portfolio, you can see our little infographic there. We have 3 different portfolios as part of patient-client experience. So we have my team, which Amber and Aaron belong to, of patient family-centered care. We have program support and development, and accreditation also falls with us. So we have a really well-rounded team. Next slide. Okay, I really wanted to highlight this slide. Those from Saskatchewan have likely seen this slide before, but you know, how I said that we amalgamated in December of 2017. And if you look at the visual off to the side, our vision, mission, values, and our philosophy of care. So you will notice in the center of that circle is patient and family-centered care. And this was work that was done in 2017. And I firmly believe that this set us up to be successful. And I'm going to talk today about mutual expectations. And I think that having patient family-centered care as the SHA's philosophy of care has really, you know, highlighted that piece around the expectation that we do things in partnership with patients, families, and residents. So just wanted to highlight that piece for everybody. Next slide. All right. So the expectations that guided our work with family presence. So the SHA values family presence as essential for patient and resident health, safety, and well-being. And we really try to move away from the visitor language. The SHA will work with patients and residents, families, and teams to maximize family presence and reduce the spread and prevent an outbreak of COVID-19. Patients and residents identify their essential family support people. The SHA will support as much family presence as we safely can. And we are committed to returning to open family presence as soon as it's safe to do so. Next slide. All right, so just grounding ourselves in the expectations that we had with our family presence work. We've been incredibly fortunate in the SHA to have such a strong commitment from our senior leaders. So here you will see a quote from our CEO on the commitment that we have to family presence. So he says, co-creating mutually beneficial partnerships is at the core of our work as a provincial organization. Families are an integral part of the healthcare journey, and collaboration opportunities on family presence policy development is key to being progressive and maximizing the care experience. We must commit in a safe way to effective family presence policies, bringing us together in the shared goal of high quality care for patients and residents. Okay, so how we structured ourselves, we really have 3 groups and we move forward the family presence work through those 3 groups. So I'm going to just take a minute here to highlight them. So our first one is our family presence expert panel. And this was a group that came together over a year ago now. So, you know, early spring 2020, when we think back to March and April, when family presence was, you know, mostly just end of life, we knew that we had some work to do. We knew that there was a difference between essential support people and visitors. So what we did in the SHA was we pulled together an expert panel, and on that expert panel, we have multiple service line leaders, executive leadership, medical health officer, an ethicist, patient family partners, and we have ad hoc membership from the University of Saskatchewan. And what this group was really tasked with was policy creation. So they helped us to develop the policy. And also they helped us make recommendations to the government of Saskatchewan on any public health order changes that we suggested or that we needed change in order to move forward with supporting as much family presence as we could. So the expert panel is still very active. We actually have a meeting this afternoon with our expert panel as we continue to move forward on family presence. Another team that we have is called the Family Presence Support Team. And this has membership from a medical health officer. We have someone from First Nation and Métis Relations, infection prevention and control, ethics, our patient client experience portfolio, and also a patient family partner. And this group provides direct support via email and phone calls to managers and leaders who need help with policy interpretation or any questions that they might have about operationalizing the family presence policy. Another piece of work that the support team does is we act as an appeal committee when a family presence concern cannot be solved through the usual SHA processes of client concern handling. And, you know, I feel like this support team has just been probably one of our biggest wins throughout our work with family presence. And we have an email address set up, a provincial email address that staff at any level can email us with whatever questions they have on family presence. We commit to getting back to them within 2 days, but it's usually the day of that we're getting back to them, either through email or picking up the phone to chat through some of the scenarios that they're dealing with. So that's been something I think has really helped the SHA move forward. Next slide. All right, so the last group that's worked with family presence is our family presence task team. And this is our group. It's the patient family center care specialist, myself, and our executive director. And we're really the doers and the people behind the scenes that take the information from the expert panel meetings. We take what we're hearing from the support team and we listen to that and we say, okay, what do we need? And so we provide support to frontline teams through a variety of forums. We've done multiple town halls and focus groups. We've done a lot of work with creating documents for staff, supporting documents to help guide them through. We've also done a lot of documents for families, residents, and patients to help explain some of the family presence work and the changes that are happening. And we also lead the work of an acute care and a long-term care consultation group. Throughout the process, again, with the expectation that we're always collaborating on our work, we knew that we needed to have a group of acute care people and long-term care folks that we could really, you know, lean into, work collaboratively with, hear from them, what's working on the front line, what could we do better, what do you need? So they've been linked into our task team, and that's been another piece that's been quite successful for us. Next slide. All right, so just wanted to touch a little bit on our policy. We're really lucky. Amber is so strong with policy work, and I feel like she always holds us to a very high standard with our language. And we've done many, many policy revisions to get our policy to a place that, you know, really reflects where we want to be as an organization with patient family-centered care. And really, the pandemic's provided us an opportunity to broadly share information about PFCC, and our family presence policy is just one of those places. So just wanted to highlight that we tried really hard to make sure that we use supportive words and the right language in our policy. And just an example here, this is right from our policy, the difference between essential support people and a visitor. Next slide. All right, so I know that this is hard to see. This is small writing here, but what we have here is just currently where we're at in Saskatchewan with family presence. So this is an at-a-glance document that we have available for everyone. This is a public document. And we have, for acute care, our acute care facilities follow our SHA family presence policy. But long-term care is a little bit different. And I know some of the other provinces have probably had this situation as well. But our long-term care family presence actually was part of our public health order, which is governed by the government of Saskatchewan. So while we had acute care following our SHA family presence policy, we had long-term care following the orders within our public health order. So, and we've had long-term care in our public health order since November. So I would say probably that's been one of our biggest struggles, is having to have two different guidelines of family presence, one for acute care and one for long-term care. Now, I'm really happy to report, and this is actually hot off the press, so fresh actually that I didn't have time to stick in a new document here on this slide, but in Saskatchewan, where we're going now with long-term care, is our province has a reopen roadmap. So that's for everybody in Saskatchewan. So once we meet a certain level of vaccination, we move through different steps. Our province has been quite successful with our vaccination so far. And so we saw that our government was proposing step 1, 2, and 3. And we thought, why don't we ask if we can align long-term care family presence to that? So we didn't want long-term care to live separately. So we put in a request and they accepted it. And it was quite a celebratory moment for our team. So right now, long-term care family presence is aligned with our Reopen Saskatchewan roadmap. So what this means for us here in Saskatchewan right now is starting on Sunday, all of our residents can have an unlimited number of designated family supports or visitors. 2 can be present at a time, and they can also have outdoor visitors and have outings into the community. And then when our province moves to step 2, family presence in long-term care also enhances at the same time to 4 visitors at a time indoors and more people outdoors. And then of course the outings to the community continue. When we get to step 3, it's still left a little bit open, but our chief medical health officer will take a look and decide where we go from there. So we were quite happy to see that. So in long-term care, again, we're still following the government of Saskatchewan's public health orders, but our acute care sites follow our SHA family presence policy. So just a win there that I wanted to share, some good news we've had in our province the past week. Next slide. All right, so one of the pieces that we're really focusing on right now is safe family presence. So going back to the mutual expectations, there's only so much that our organization can do to make sure that family presence is safe. What we really need is for our residents, patients, families to also commit to safe family presence. Because if we're both committed, that's where we will be successful. And I think we have been successful. So one of the things I just wanted to highlight here, this is an infographic that we've used in our organization. We've come a long way in a year. So if we think back the difference between family presence last spring and family presence now, and all of the different safety pieces that are in place. So just as an example, we have staff cohorting. We have healthcare worker and visitor screening, masking, eye protection, and also point of care testing. Point of care testing is now offered to all of our family supports and visitors in long-term care. We have public health measures, including hand hygiene and physical distancing, enhanced monitoring and surveillance of our residents, safety reviews, and education and orientation for our essential family supports. And of course, right now working through the vaccination program for our residents and our staff. Next slide. All right. So just a little bit more on safe family presence. So we are running a campaign right now that I think we're really excited about because, you know, and I'm sure that lots of you on the call and your organizations have probably heard this before, where we'll get feedback saying, well, why is long-term care opening up? We need to keep our residents safe, or we need to keep our patients safe in acute care. And so really trying to show and educate the public and families that family presence is safe. There's pieces that we have in place that make it safe. So that's something that we've been really working on. And this is just an example of one of the templates that we've been using. So really using this to reinforce safety and ground our rules with our why. Why is family presence important, and why do we need to do it safely? Next slide. So again, just a couple more photos here for you to see to reinforce a simple and visual narrative. We are currently running a social media campaign. We do have quite a bit of followers on the different SHA social media sites, so we've been able to reach quite a few people. And one of the exciting pieces that we're working on now is using storytelling to share about safe family presence. So some of the work that's happening today is we're reaching out to some of our residents and some of our families to see if they'd be willing to be part of our Safe Family Presence campaign and share, what the new family presence guidelines mean for them and how they're committing to do it in a safe way. Just an example here of some of the at-a-glance tools and communication that we've created for staff and families. So we've done Huddle talks, we've had multiple articles in our SHA daily emails, we've crafted a lot of letters to families, various posters on the various safe family presence topics, Q&As, and a series of the safe family presence handouts for families. We also have space on our SHA website for family presence. So if anyone's planning on visiting an acute care facility or a long-term care home, they can go here and access all of the information that they would need. All right, so this is my last slide, and I'm really excited about this, and this is also hot off the press. So the future of family presence and patient family-centered care. So again, with the expectation that our organization has that patient family-centered care is our philosophy of care. And so really exciting to see that family presence and patient family-centered care is built into our 2020-2021 strategic plan. So a couple of action statements we have in there that I wanted to highlight for the group today. And this is the work that will be happening over the next year, is that we commit to reaffirming our commitment to patient family-centered care and expanding this in the introduction of integrated people-centered care and recognizing patients, residents, and families as essential members of our care teams. Another one of our actions for this year is we seek to understand and acknowledge the unintended consequences of COVID-19 on patients, residents, families, communities, providers, staff, and physicians, and while validating feelings and establishing trust as foundations for partnership in system recovery. The next action statement is to collaborate with residents, families, providers, staff, and physicians to understand the impact of COVID-19 to inform and action system recovery in continuing care. And then the last one is in alignment with our family presence policy and the public health order. Essential family members are integrated as partners in the care team. Family members and visitors are welcomed as important supports for patients, residents, and staff. So that's what our year ahead looks like. Again, really exciting to think about how we've really been able to highlight patient family-centered care through the family presence work. Given that our organization is so young, there's been a lot of hardships over the past year, but when our team reflects back on the pieces that were really a win for us, I think being able to show the SHA's commitment to patient family-centered care through safe family presence has been a win, and we just plan to really build on some of that momentum. And I think that's it. Time for questions.
That was wonderful, Kristin. Thank you for sharing what's been happening in Saskatchewan. And I love how you ended in really thinking about the future and what is the commitment to the future and how are we learning from the lessons learned of the past year and a bit now. I also love how you started the conversation with talking about the importance of having embedded this philosophy of patient and family centered care across Saskatchewan, and how that was really a foundation for you as you were able to build into this work. So thank you. Now I'm going into the chat box. I'm going to start with a couple of questions that are coming from our friends and colleagues out in Alberta. So I'm starting with Jason, who has a question around accreditation cycles. So wondering if you've had any accreditation cycles since implementing your family presence approach, and if so, how has it gone, specifically regarding family presence, patient and caregiver rights, and any words of wisdom to share?
Yeah, Jason, that's a great question. I'm not the accreditation expert, but I'll share what I know. We did have a small virtual accreditation survey happen last year, but nothing in particular around family presence that would have been done through the accreditation cycle that we had. Sorry, I don't have more information to share on that, but I can probably follow up after through email if needed.
We also have another one from Jennifer in Alberta as well, asking about faith leaders and elders. So where do faith leaders, elders, legal representatives fit in? What about doulas who are not staff, but personal service providers? So where does that fit into family presence policies?
Yeah, that's a great question. So the expert panel that I had talked about, is my connection okay? I just got a pop up that I might not. Okay, I'm good. So the expert panel, we were sure to make sure that we included our partners from First Nation and Métis relations, as well as spiritual care, because we knew that elders are an essential part of the care team. We knew that spiritual care was an essential part of the care team. So those folks have been part of the expert panel and have been bringing that piece forward to our policy. And I can turn it over to Amber. I believe we do have pieces in our policy that reflect spiritual care, First Nation, Métis relations.
Yes, I have to say I haven't looked at that particular section in a while, but yeah, there are provisions. Certainly, it's part of looking at what are the needs of the individual, and we always want to make sure that we're looking at addressing the individual needs. So if there are questions on the front line as to, depending on if they're outbreak situation, what's happening in that facility or home, then that's where our support team can assist in making sure that we do it safely. But absolutely, that's a large piece of meeting those needs of individuals.
There's a bit of a follow-up question from Jennifer here. Are they their own category under essential care providers or under visitors?
I would say that we've got them, they're not just the visitor category, like they're in their own section on, trying to think of the wording. So if anyone, Erin or Kristin.
They would be considered essential care providers, and they were considered part of the care team. Yeah, they weren't included as one of the designated family support people. They were part of the care team.
That's a good distinction. Thanks for clarifying that. I'm going to encourage folks to keep adding their questions to the chat box. There is another one here from our good friend in Kingston, Angela. Curious about the consistency of the application of the guidelines at the local level, and in particular in acute care organizations. What has that looked like across the province? I mean, thinking of you as a provincial health authority and a provincial policy that you are seeking to implement, how has it looked in the various local regions?
Yeah. Well, I can start, and Erin can probably follow up a little bit because she leads our support team, so talks all day long with our frontline supports. But I would say consistency on implementation was by far one of our biggest challenges. Again, Carol, like you said, we're a huge organization. We span the entire province. So even just our people, The people that we serve and the people that we work with are different across our province. Everyone has different needs. We went from operating in these 12 smaller regions to now SHA, one big organization. And the question was around acute care. And we have two main urban sites in Saskatchewan, Regina and Saskatoon. And then we have a bunch of smaller rural sites. And so I would say that rural sites across the province operated quite similarly, had the same challenges with implementation, but acute care was different. Urban was a lot more complex than our smaller rural sites. So we've had some of the members from our team work very closely with our urban centers in acute care on family presence in particular. So yeah, implementation was tough. Definitely some challenges in our bigger acute care sites. Another piece that I think contributed to that is our urban center saw quite a few more COVID cases. The local epidemiology was often higher in those sites. And of course, more people. So that was some of the pieces that we struggled with, but again, put in some dedicated supports to walk them through that. Erin, do you have anything to add?
Well, one thing we worked really hard is building consistency across the province, specifically in long-term care through town halls. So we worked really hard. We did small town halls throughout the province to build those consistencies. And we've definitely come a long ways in long-term care and acute care with that.
Thanks for adding that, Erin. And just to clarify, when you were doing town halls, who was the audience that you were capturing in those town halls?
Well, we opened it up to directors to invite their managers, and often it was frontline staff. So sometimes managers were struggling with implementing family presence in their facilities. So they would ask us to come in and do a smaller town hall with just their team in that facility. So just a kind of a variety. Mm-hmm. And then we did town halls with the quality of care coordinators who were getting concerns from the patients and the families themselves, just so they had a good, strong understanding of what the guidelines and public health orders meant.
Thanks for that clarification. I'm just noticing in the chat, people in awe, I think, of the many resources that you've developed, and you may be getting some reach outs about that. And that we will certainly, if they are publicly available, also happy to share through the Essential Together site. There's another question here in regards to, have you included family in your patient's rights and responsibility documents?
Yeah, so within SHA, our patients and residents' rights and responsibilities was something that, again, was part of those 12 smaller health regions. And now that we're SHA, that was some of the work that was just getting started. So the various areas are still working off some of their former rights and responsibilities documents. But when I think about the rights and responsibilities of patients and residents, in terms of family presence, that's something that we've worked really hard to make sure that we've captured, and we've had patient family partners partner with us on all of our family presence work. All of the different groups that I had listed, we made sure that we always had patient family partners as part of that work. We have residents as part of that work, family members who might not have partnered with SHA before, but were going through some of the family presence hardships with their families, and they wanted to be part of it and they wanted to help. So yeah, we've really remained committed to making sure that we're hearing from our residents and our families.
Mm-hmm. I'm going to merge the next two questions together because I think they're aligned. So the approach that you've taken to family presence, has it been used across multiple settings? And I think you had talked about both acute care and aligning what you were doing in long-term care. So hospitals, also long-term care, home and community care settings. And then from Ashley, were there any unique considerations that you had specifically for mental health and addiction inpatient programs as well?
Yeah. For sure. So yeah, we really had kind of the two separate pieces. We had long-term care and acute care, but under our acute care family presence policy is where mental health and addictions would have fallen. And on our expert panel, we did have representation from mental health and addictions to make sure that we were capturing the needs of that specific service line, to make sure that our family presence policy was supportive enough for them. Some of the pieces that I think, just off the top of my head, that we've continued to give extra support to mental health and addictions would be through some of the day pass or outings work that we've been doing. We've done a lot of work on putting together different risk assessments when patients might go on a day pass, and then welcoming them back safely to the facility. So yeah, again, just our link through our expert panel to that service line.
I'm going to get to I think one more question here, and it's with respect to safety. Have you addressed safety structures beyond the risks of COVID?
Yeah, so our portfolio falls within the greater quality and safety strategy. So I would say our work has been focused on the COVID response and family presence in a safe way this past year, but certainly our colleagues in staff safety and patient safety have done an incredible amount of work, mostly COVID related, through the past year on setting up various safety structures within SHA. Prior to COVID, all of those pieces were getting set up, and we have many safety structures in place at different levels of the organization.
Okay. I'm going to ask one last question. Oh, there's one more before. Have you had any discussions with private long-term care organizations about family presence?
Yeah, actually we have. So our private long-term care homes, they would be the responsibility of the Ministry of Health. But because we work closely with our government, especially through the long-term care family presence work, our private care homes follow the same family presence guidelines that we do in the Saskatchewan Health Authority. So our support team, which is the email, gets used quite often by our private care homes. And Erin gets a lot of questions, and I think she's built a lot of relationships with our private care homes over the past year, just really supporting them, just like we support the SHA as best we can. Erin, I don't know if you have anything else to add to that.
Yep, they've definitely tried to align with everything that SHA facilities are doing, and often reach out for support. So
yeah.
Yeah, I mean, I think this has been such an interesting area because of the many sectors that we've been dealing with, and then also within long-term care, both private and public. But it just, I think what you have really demonstrated, what's been happening in Saskatchewan, just the multi-faceted approach that you have taken to ensuring family presence, the presence of essential care partners throughout this time. And again, I love the future orientation that you're taking to this, and thinking about how do you and how do all of us make this commitment, thinking to the future, so that we don't see what happened in those early days of the pandemic happen again. And I just also wanted to point out to your campaign as well, is fascinating. And so I would love to be reaching out to you on that one as well. I think that the importance of education. So I am noticing the time, and just want to say a huge thank you to all of you in Saskatchewan, Kristin, Amber, Erin, for an excellent and engaging discussion, and to our audience as well. And we hope that you found this session informative. So some upcoming huddles that we have in June, we have 2 coming up. One speaking about caregiver ID to support integration of essential care partners, and also staff training by caregiver care to support staff and the reintegration of essential care partners. We will be announcing new dates in the for fall 2021 for more huddles that will be coming up. And that if you're interested in sharing or watching any of these huddles, they are available on our website a few days after the recordings are made available. And we'd also like to highlight other huddles and speakers that may be of interest that are happening across Healthcare Excellence Canada, particularly coming out of our long-term Care Plus programming and expanded teams, which will be including huddles on infection prevention and control in long-term care. That one's happening in July, and discussions about harm reduction and vaccination in June. And please consider registering for Essential Together. There are opportunities for coaching and, again, opportunities like this for some peer learning. We're going to be starting a Yammer channel soon, and you will get that information sent out to you shortly. Thanks again to our speakers, and please connect with us through email or our web pages. And we invite you to sign up for our newsletter to learn more about what's happening at HEC. So again, a huge thank you to all of you, Kristin, Amber, and Aaron, for an excellent presentation, and a huge thanks to the HEC staff and the interpreters who make all of this happen behind the scenes. And of course, a huge thank you to you, our audience, for joining us today. This concludes today's webinar. Have a great day, and thanks again.